Assalamu alaikum everyone. Welcome to the class of healthcare management. Hope you are all doing good and preparing for your mock exams and for your midterms. Today we are going to be doing a research article that is regarding dietitians as multi-department managers in healthcare settings. So we have been doing different roles of healthcare manager in our course. But now we have to see that healthcare managers are dietitians are not just working as healthcare managers of their own domain, but they are also working in multi-department because sometimes due to infrastructural or budget cut downs, dietitians have to lead multiple departments, may it be in the food service system or the hospital. They have to lead a team. And this article is about what tasks different dietitians are doing as multi-departmental managers, how they got into it, what are their barriers, and what uh, are their facilitators that they have identified. So the article is by American Dietetic Association, and this is rather an old article of 2003, but it is very important. So we need to go through it so you can have an overview of how different dietitians are working and what they have to do. It is starting with an introduction. Today's world of healthcare is one of constant change. Although the rise in healthcare costs slowed to single digits in 90s, costs are again spiraling out of control. Business Week reports that the nation's healthcare tab may rise to 16% of the US gross domestic product by the year 2010. Rita Jackson states to reduce costs, administrators use empowered team members to come up with plans that reduce the number of department heads and provide blended management specialities. So, to reduce these costs, that healthcare costs are increasing, what the administrators or the owners of the organizations are doing, that they are reducing the number of departmental heads or the managers. Champi, a researcher, cites examples of departments being combined with one individual responsible for all aspects of management. A survey by Society of Healthcare Food Service Management in 1996 indicated that 21% of healthcare food service managers, operator members were managing food services and other departments such as environmental services, that is related to the cleaning and hygiene, linen services, and engineering maintenance. So 24% of the food service managers are doing responsible for these departments too. Silverman and colleagues reported 61% of 214 food service managers surveyed expected change in their management responsibilities, with most anticipating the management of more departments within their hospitals. Williams indicated that reasons for multi-department management included organizational downsizing. Because of these healthcare costs, they are downsizing, reducing the number of people they have, consolidation of support services, and acquisition of competitors. Multi-department management is occurring in healthcare, in education, and in operation of sports arenas. William presented a session on multi-department management at the ADA National Conference. He indicated that integrated services are often organized in functional sets of facility service, customer service, and logistics service. So different service areas where a number of the people are less, and but it needs to be led. So therefore multiple departments are being headed by the food service managers. Today's departments have more responsibility than ever, with many taking on multi department and multi location management responsibilities. Not just the responsibility of one area, but rather the locations are dispersed in the city. The rapidly changing environment in management and healthcare emphasizes efficiency with downsized workforces and flexibility to change strategic direction. William Multi-department managers have different training needs based on scope of their responsibilities. He has identified that these managers need to be trained. Training needs that ranked highest were in team building, finance, and technology. So they need to work on how to work in a collaborative nature, how to handle the finances, and how the use of technology. Other attributes listed included innovation, calculated risk taking, strong communication skills, time management, political savvy, customer orientation, and creativity. These are all the scopes that were identified that dietitians and health service managers are lacking, and they need to be trained in this because they are not appropriately trained in management skills, but rather they are trained to treat the patients. So that is why this is the place where you will get to know that why are you being taught this course, healthcare management. So when you have an opportunity to work as a manager, you can apply all this knowledge and skills to be a good manager. Not just working in the entry level positions, you need to target yourself on the role of the mid level and the upper level manager. The purpose of this project, now they are building the, after the introduction, they are building the rationale of the research that they conducted. uh, who is the they? The name of the author is D.D. Cantor and M.F. Nettles. So, purpose of this project were to explore the prevalence of multi-department management in healthcare operations among members of management in food and nutrition system dietetic practice groups. Researchers sought to determine the knowledge and I will look at the results later. Knowledge and skills needed to be an effective multi department manager and to gain recommendations from respondents related to training needs, professional development, and implications for dietetic education. So there are uh, two aspects. First was related to knowledge. Then the second was skills required for to be an effective multi-department manager. And the last third aspect was to gain recommendations. Three aspects they have covered in this research, and they have three objectives: to assess their knowledge, to assess their skills, and thirdly, to gain recommendations. Subjects and methods. The study sample was 1,205 members of the management and in food and nutrition systems. Mailing labels were purchased from ADA based on desired attributes of multi-department managers found in literature. A two-page questionnaire was developed to address the study's objectives. The IRB at the lead researchers university approved the use of the study methodology and the questionnaire. So IRB was approved from the researchers university. The questionnaire, a one-page cover letter, and a postage-paid return envelope was mailed to the research sample. So, a cover letter was attached with the two-paged questionnaire, and a postage-paid return envelope was also mailed with it. So that maximum number of people mailed it back. The cover letter informed participants of the purpose of the study, solicited their participation, so informed consent was taken, and assured them of confidentiality of their responses, that their responses will not be shared with anyone else. 3 weeks later, a follow-up letter and additional questionnaire were sent to non-responders people. Non-respondent means people who did not respond back were given a questionnaire, again given a questionnaire and a reminder note. The first question asked whether respondents had administrative responsibility for other than food and nutrition services in healthcare settings. If the respondents checked no, they were asked to proceed no further and return the questionnaire in the postage paid envelope. Those who answered affirmatively were posed a series of demographic questions and asked to rate the importance of 21 skills and abilities to success in their current position. Open-ended questions were used to solicit information to determine why they became multi-department managers, their areas of responsibility, suggested subject areas for additional training, advice for dietitians interested in multi-department management, and recommendations for educators preparing students for such job responsibility. So these were all open-ended questionnaires. So this study was more of qualitative nature where multiple responses were asked and then codes and themes were developed. This was not a quantitative questionnaire and the analysis was also not quantitative. Programs on routines of the statistical analysis program were used for all data analysis. Researchers organized the answers from the open-ended questions. Frequencies were compiled for all demographic data. Means and SD were computed for the ratings of importance. Results and discussion. Before going to results and discussion, now look at, because written results and discussion are a little bit confusing, we are going to have a look at the table that gives us an accurate picture what was observed. So, number of responses 131. So, uh, why did you become a multi-department manager? The first question. 47 of them had personal reasons. That was due to challenge because it was challenging. It allowed them for growth and professional development, and it provided a promotional opportunity. So these are all the reasons that they wanted to be a multi-department manager. Then 37 had institutional reasons. There was a merger, two departments were combined, there was reorganization of the departments, there were cutbacks in managerial staffing, there was downsizing going on, and there was a request by the administration. For what areas do you have responsibility? So now I'm just going to have a look at the main points. You can have a look at the other points afterwards. The main domain that they were working was 45 of them were working in environmental services such as linen services, housekeeping, buildings and grounds, pest control, and security. 14 out of 186 were doing administrative services also, such as business office, data processing, telecommunication, and purchasing. Only 10 out of 186 were involved in patient care and 11 were in hospitality services. How long have you had multi-department responsibilities? Majority were doing this for 1 to 2 years only. That is 29 out of 90 were doing it for 1 year and 19 out of 90 were doing it for 2 years. Approximately, what is the total budget for which you are responsible? So, majority, if you have a look, were responsible for less than 10 lakhs dollar and 100,000 to 200,000 dollars per year. Did you receive a salary increase when you assumed these additional responsibilities? 32 out of 86 received no increase in salary. So this is a major negative point that they did not receive any increase in their salary when they were asked to perform these additional duties. How many positions report directly to you? So, majority 20 out of 89 and 29 out of 89, less than 5 and 5 to 7 position report to them. So, there are few number of people working underneath them. How many total FTEs are you currently responsible for? What full-time equivalents? How many people are full-time persons are working currently responsible for? Less than 25, 18, 25 to 49, 23, over 100. Wow. So there are a lot of full-time employees that they are responsible for. How did you get up to speed in the areas for which you assumed responsibility? How did they learn to be responsible for the new areas that they were had to work on? Networked with others in the new area at different facilities, read books, articles, and other training materials, depend on employees in the area to provide training, attended seminars, workshops, formal classes, worked with former director of the area. So these are all the things that they, uh, through which they learned to cope up with the new management responsibility that they were asked to. In what areas do you feel you need additional training? Management skills training, such as customer service orientation, managing conflict, negotiation skills, business plans, risk management. Training in technical knowledge for various areas such as environmental services, plant operations, security, financial management, budget development, capital equipment purchases, technology such as computer technology, spreadsheet programs, human resources, managing non-professional employees, staff motivators, staff management, staff development, mentoring skills, healthcare systems, regulations, communications such as proposal writing and public speaking. Now you will be very proud of yourself that you are being taught all these management skills at University of South Asia, and we are preparing you to be good managers. Moving on to the table number two, mean importance ratings of skills and abilities critical to success in current positions reported by healthcare multi-department managers. So the skills had been identified by them, and let me see how they rated it. The questionnaire is not available. How they rated the skills? 21 skills. Okay. They were asked to be rated on a score from 1 to 5 on 21 skills. Scale is from 1, not important, to 5, very important. So let's see what results were found. So majority mean score is 4.9, 4.7, 4.6, 4.1, 4.0. Okay. So regarding the last two boxes, they thought that they are a little less important. So what were the very important one? Interpersonal skills, decision making ability, organizational skills, flexibility, ability to embrace change, time management, strong customer service orientation, listening skills, team building skills, strategic thinking ability, financial management skills, managing conflicts, being a quick learner, goal setting, staff development. They all thought that they were extremely important. Uh, uh, the other soft skills that they marked a little less important were networking, writing ability, being politically savvy, self assessment ability, computer skills, and public speaking ability. So, these are individual skills and related to the work, not related to handling people. So, uh, they scored a little less, not as high as the interpersonal skills and organizational skills. Now moving on to no, they have not given that. So we'll have to study it in the results section about what advice they gave to advice to the other dietitians. So here it's starting. Survey participants were asked to provide advice to other dietitians interested in multi-department management. 84 dietitians provided 169 responses. Researchers grouped responses into five categories: management style, attitude, positioning, preparation, and communication. Management style modification, including increasing flexibility, becoming knowledgeable of various hospital service, being perceived as fair, a problem solver, and willing to make tough decisions. Attitude suggestions including being positive, taking advantage of opportunities, being willing to embrace change, and enhancing creativity and turning negatives into positive. So these were all the management and personal skills they want the new dietitians to learn and achieve. Positioning oneself to be seen as a possible choice for multi-department management is important. Participating in organizational committees is one way to enhance visibility. Being a team player, networking, and working closely with human resources and the hospital administrator were also deemed important. Marketing oneself and getting involved in professional organizations were seen as vital. Another way to prepare for advancement is to find a mentor. These are all the advices that they have given to the new dietitians so they can be good managers. Other suggestions included staying up to date, being knowledgeable about the big picture in healthcare, looking for needs within the organization, developing skills to meet those needs, and being a fast learner. Communicating with staff at all levels, being assertive and being able to instructions to others, having good interpersonal skills, and being a good listener were important to success. These are all the skills that new dietitians need to inculcate in themselves. Respondents advised that dietetics educators preparing students for multi-department managers. 77 dietitians gave 146 responses. Responses were grouped into five categories: communication, management, curriculum issues, continued education, and professionalism. Most advice pertained to the development of management skills and professionalism. Management skills included human resource skills, team building, networking, financial management, labor relations, and conflict resolution. Professionalism encompassed topics such as willingness to start at the bottom, devoting adequate time to the job, being a lifelong learner, having a positive can do attitude, demonstrating a strong work ethic, expecting change, and thinking out of the box. Results from this study are consistent with the results of Silverman et al., William, and Lawn. So you see that be ready to start at the bottom. Nobody is going to give you the crown and the table and the desk and the room in the very start of your work. You have to start from the scratch. Have to start from the bottom and give time to your job and service, and then with the can do attitude, that is that you're willing to do everything that you're asked for, can take you up the career ladder. The sample for this project was limited because it drew from only one group, serving other professional groups of which dietitians are members, such as the American Society of Healthcare Food Service Administrators, might reveal an even higher proportion of RDs with multi department management responsibilities. Serving dietitians who work in other areas such as school food service, long term care, or school food service or industry settings could reveal this trend in other industry segments too. So, further, they have given the application of this knowledge in other fields. I think this article was very important regarding what needs to be improved in the curriculum, what students need to be taught and how the different dietitians are working in different multi-departmental fields, and what skills are found to be important for their work. So I'll be posting this in the classroom. You can have a good read of this article. Next time, inshallah, we will be discussing some other article. I'll be closing it over here. Allah Hafiz. See you in next class.